Okay, here's everything that happened in medicine and healthcare this week. We have a lot to cover, and it's going to be part one. On Monday, we learned about a 700% increase when it came to poison control calls because children were getting access to nicotine pouches thinking they were candy. We also learned about a study that was at a conference recently that suggested that men may be able to raise their testosterone to normal levels if they have type 2 diabetes or obesity while taking things like Ozempic. Lastly, some promising research when it comes to a weekly shot instead of having to take daily pills for things like Parkinson's disease. Tuesday, there was a large study when it came to previous smokers that talked about they had better chances of quitting when it came to taking vapes as compared to taking things like nicotine lozenges. On Tuesday, we also got an announcement from the ice cream makers saying that over 90% of all their ice creams are going to be removing artificial dyes and coloring by 2027, at least if they're store bought. Yet another study at a conference that was not published but suggested that taking things like Mounjaro may be able to reduce your risk of obesity-related breast cancer, but the study was done in mice, so we'll see how that turns out. Wednesday, medical debt will now be shown on your credit report after a ruling by the Biden administration was overruled by a Texas federal judge. On Wednesday, Medicare also proposed a 3.8% increase for physicians' payment if they had their health outcomes tied to how well their patients actually do. Those who don't take part in this measure will still see an increase of about 3.3% though. That's all the information for Monday, Tuesday, and part of Wednesday. We'll be going over the rest of it tomorrow. But if you want any of the specific information or the links to it, you can find it in the Substack with the link in my bio. Over there, you'll get a more in-depth analysis and a better explanation as to what actually happened. Monday's article is free, but you can see the rest, at least partial previews. I'll see you tomorrow for the rest of the information.